Well, as I mentioned before the break, it's time to go back to Richard Newton now. He's at the Bongani Regional Hospital in Welkom, and we're seeing what's happening with the Free State Health Department launching Operation Back to Care in support of the province's Operation Hlasela. So let's find out more about that. Richard, it's over to you.
Well, welcome back to Bongani Hospital. We have moved inside, and although there's a lot of activity going on around me, I feel I should be whispering in the hotel corridors. But yes, we're looking at exactly what the hospital services have to offer. We're looking at the state of Free State Health, and of course, as we said earlier, this is the last stop in a media tour that the health department has arranged to look at the challenges facing the health department and what has been done and what still needs to be done. And joining me here, we have the acting CEO of the hospital, Dr. Nahed Al-Algara. Doctor, what exactly, we know that there's a large focus on babies. I believe you have about 500 a month that are born here. What services are offered here at the hospital?
In the hospital, we have majority of the specialty. We have obs and gynae, we have ophthalmology, we have surgery, we have internal medicine. We're running also the HIV and the TB clinics, and we have a theater running 24-hour, 7 to 7. And we're dealing in obs and gynae, we have 500 delivery a month. And remember, Bongani is a regional hospital and the only regional hospital in Lujulubuso. We don't have another hospital in Welkom. We don't have district hospital in Welkom. We have Tusano Hospital is in the district. We have Katleo Hospital, and Bongani is the central for 5 district hospital. All this hospital is referring to Bongani, and we have overload of the patient. We're concentrating, that is the reality, we're concentrating in the mother and the child. We're trying to save how much mother we can. We're trying to save babies, because we're looking after the pregnant woman from the beginning of the pregnancy until delivery. We want all the women who's pregnant when they're leaving this hospital to live with the baby, not to lose her baby. Because when the pregnant woman is pregnant, not she's the only one who's pregnant. The whole community is pregnant. The whole street is pregnant. The whole family is pregnant because they're suspecting this baby. And we're trying our best to do that. Now we have many challenges in the hospital that we're trying to make achievement in the hospital. We appoint many people since October. We appoint 25 nurses. We appoint 10 medical officer doctors. We appoint 5 specialists. We're trying our best, because the problem we don't have many doctors who apply this side. And if they apply and we recruit them, they work with us for a few months, then they're running, because they go into specialize, they want to become specialists, and that is good. We're trying our best to make the achievement in Bongani Regional Hospital, and I am sure the community realize that we make achievement.
And you're saying that you cater for a number of towns. It is a regional hospital. What is your workload? What is your patient load on average?
Remember, the only regional hospital for Lujulubusa. Lujulubusa is 690,000 the number of the population, and to be a regional hospital and you don't have district hospital in Welkom, like in town like Welkom, that's impossible, and will help if we can succeed to have this district hospital in Welkom.
And if you had to sort of give a wish list of what you would really need to improve your service as much as possible, what would you start with? We
have all the support from the MEC, from the Premier, from the head office in general, even from the minister, to try to make the achievement. We bought equipment. We will have more staff. From February, we will have another 25 nursing. From February, we will have another 5 doctors. They will start. Yesterday, the Premier, he approved also for us 10 doctors yesterday. Because we're trying that, we have the approval, we have the bus, that we don't have the doctor. We're trying to recruit from all over doctors.
And over the last few years, there have been a lot of criticisms coming. As you've said, you have a major workload. But with these new doctors coming in, do you see that you'll be able to make a marked difference?
Of course. If we will have more doctors and more staff, we will make big achievement. We will save many patients, and we will save the whole community. No patient will die, no baby will die. There also we need the support from the community. The community must support us. If the woman is pregnant, she must start from the beginning of the pregnancy to go to the primary health care to check. And if they find any problem, they will refer her to us as a high-risk patient.
And yes, you have the emphasis on the pregnancy and childbirth and childcare, but casualty itself, I mean, we've heard a lot of stories that people lie on the floor in casualty. What is the casualty department like?
That is really. The reality, we have shortage of, I mentioned it, because shortage of district hospital, because we don't have district hospital in Welcome. And after 4 o'clock, all the clinic is closed. Now the patient referring himself by himself to casualty. And the number of patients in casualty daily around 160 patients. And that's impossible for casualty because everybody, and if you can check all these patients, majority of them is chronic patient in chronic medication. They should not be in level 2. The hospital is for every patient, for every member of the community, for the whole South African. That we have rule. The patient also must support us to follow the rule, to go to the primary health care, from primary health care must go to the district hospital. If the district hospital find any problem, then he will contact the regional hospital and the patient will be referred for the specialist. Because the overload, the patient is referring themselves, and we cannot refuse to see this patient. That is the problem in casualty.
Dr. Nahed Algara, thank you so much for your time. We really appreciate it. There we have it. The doctor saying, yes, there is a massive workload here, but they also like the community to do as much as possible to assist them to be able to deal with it in casualty and in other areas. So from Bongani Hospital, we send it back to the studio for an ad break.